Hey y'all, it's Cher and
Dawn.
And welcome back to the Chattermouth Podcast. So today we have a very special guest, probably my favorite guest of the season is here. My husband, aka Dr. Jared Gopman in the house.
Oh, so excited to have you, Jared. You know, you're a graduated plastic surgery. You're a plastic surgeon now, and I'm so excited. I have so many questions, and I want to be a first patient.
Well, thank you guys so much for allowing me to finally make the cut. It took, what is this, like third season before I was finally allowed on?
Only the second season, but we are many episodes down the line. But you're here, and I'm so happy. So thank you for joining.
Happy to be here. Thank you guys so much. I love seeing your intro. I've never seen that before in person. You guys are very well coordinated.
Yeah. I know. When I was saying it, I saw you at the corner of my eye, like almost laughing. And I was like, oh no. So funny. So yes, my mom is like super excited that you're a plastic surgeon.
I don't know how you... I'm just really excited. I have a list of things, you know, how to stay young and what to do to get young.
Aren't you doing it all already?
Never enough.
Are you gonna listen to me anyway, no matter what I say?
I'll probably question and pick everything apart.
Typical.
So it's just like normal day then.
I know she like wants to be your first patient. Well, you had many patients. Your first family patient, excuse me.
Right.
But I don't know if you would work on her. Would you work on?
Would you work on family?
I don't know. Something small, I think I would. Like if it's a little like mole or something like that, or maybe even Botox or fillers I would do. But I don't know. I don't think a big surgery is really a good idea to do on family, especially not in the beginning because, you know, if have a colleague do it, then maybe I'll be mad at them if it doesn't come out right. But if it doesn't come out right and I did it, then I'm just going to be mad at myself for every time I see you for the next like 30
or she'll
years.
Be mad at you.
Right, and then you'll be mad at me at every holiday. Every time we go to Passover dinner, I'll need to do a follow up and bring some scar cream or something like that.
I know. I don't know how I'd feel about you looking at my mom's boobs. I mean, that wouldn't fly, right? I don't think that's.
Would you do my boobs?
Oh my God, stop.
Besides the fact that you're my mother-in-law, boobs at this point are boobs to me. We've seen so many, you know, and throughout all the years. But
it's so funny, Jared. I remember when I first became a plastic surgeon, like you were first going through it, and I was like, oh, he's gonna have to look at other girls' boobs. Do you remember that?
Yeah, you got really mad at me when you realized that what it meant for me to go through this residency.
Yeah. He was at first when he was going through it, I was like, oh my gosh, he's gonna have like good-looking girls, like just like lifting. Like that's kind of like every guy's dream job. Kind of. I know you don't look at boobs like that anymore.
Yeah, well,
you don't look at it. But like for a young boy would think that, you know what I mean?
Right, but I don't think he
like
sees it like
that.
that.
Not
it's
anymore.
So interesting.
It's just weird, right?
It's right.
Now it's more, there's so many, it's not just like, you know, sometimes you see a nice pair of boobs and you're just like, nice. But but there's so much more technical aspects that go into it nowadays. And like now I feel like I appreciate boobs so much more than I used to even, because like now I know what it takes to really make nice surgical breasts.
So interesting.
Let me ask you, when you look at someone, do you right away zone into their flaws and how you can change certain things on a person?
Immediately.
Do you actually?
Interesting.
Immediately.
Really?
You can't help it because it's like...
Oh, no.
It's terrible.
I know. Don't
it's just like if a car mechanic sees a car, they immediately see what's wrong with the car. Mm-hmm. You know, we are trained to look at pathology, to look at what's wrong, and there's nobody has anything wrong with them, especially in the aesthetic part of plastic surgery, but there are like ideal aesthetic appearances and measurements and angles and relationships that we are trained to have, and now those have biases, of course. But when you see things that deviate from that, especially if it's very much so deviates from that, then it's very noticeable.
So interesting. So you look at people differently than the regular Joe Smith or the Joe, you know.
I think if somebody has like a really messed up nose, or if somebody has like a very like odd breast like asymmetry. I think the normal layman person would look at it and be like, oh, something doesn't look right with that, right? Like, right? You guys notice that too.
Right.
But only like now I'm able to hone in much more so on, you know, the actual pathology of what is the problem most likely. And then you go into what would I do to fix that, which is the fun part of it, you know?
Right.
But I learned a long time ago, you never tell people what's wrong with them. If somebody, even if they ask, because they don't actually want to know. They don't want to know, and you get into a lot of trouble. So I never say anything.
But do you like sometimes want to bite your tongue and say, oh, I just want to fix that nose, or just want to fix that ear, or whatever it is?
I think that, it's all our own life. And the way I look at it is I tell people, look, this is your body. It's not my body. This is your body. If you want this, if this bothers you and you want this change, this is what I can do to help you. But I never try and push surgery onto anybody, especially for cosmetic surgery. And, that is very unethical, and you open up a big can of worms and you put yourself at risk for a very unhappy patient relationship if you do that. So patients come in and, I say, what are you here for? What bothers you? Even if somebody comes in and I'm like, you probably need a facelift like immediately. But if they're here to talk about their breasts, then I don't even mention the face. I don't talk about it.
It's good because if you point something out to them, they might not have even realized it. All of a sudden, because you said it, they respect you as a plastic surgeon. They're going to start being like, oh my gosh, my face, I need I need that. So your words matter a lot now.
Very much so.
What's so wonderful about you, Jared, is you're going to build like other women and other men, give them such more self-esteem and more confidence, because when you feel you look good, you feel good, and that really like blossoms and shows, and you're going to have that give that to so many more people out there, and it's so wonderful.
But, I think a lot of people don't realize how much a plastic surgeon does. Like, yes, there's the aesthetic side of things, and that's when I think of plastic surgery, my mind always went to that side. But you do so much more, and I've seen you grow and do all these amazing surgeries, but like, there's so much that you guys do.
I mean, it's crazy. I'll have a day during residency especially where I would operate on somebody's scalp, and then I would operate on somebody's hand, and then I would operate on somebody's breast, and then I would operate on somebody's like knee area, and you would operate on, or their butt area, and it would be a different part of the body. Plastic surgeons operate on all parts of the body. We're the last real general surgeons out there, and it's very interesting. And the nice thing about it is that it's never boring because there's so much variety you can do.
It is cool.
It is just
it's amazing.
I mean, even to help like women, which is so prevalent today, breast cancer, and they lose their breasts and they feel less of a woman. Some women do, and you're able to create this breast and make them feel whole again is just like a wonderful thing that you're doing.
And you guys both know this. That's originally what got me into this field. Is when Amy, my mom, had breast cancer, and she went through breast reconstruction, and her experience with regaining her breasts through surgery, she had implants afterwards. That was the big catalyst that made me look at the plastic surgery when I was in medical school, and ultimately what got me to this point. So I agree, like that's helping breast reconstruction patients is some of the most rewarding work you can do.
Yes.
Yeah. That is amazing. It's so fabulous, all the different things that you can do, though, because it's not just the aesthetic field. Like, now you're going to be specializing a lot doing hand. And can you tell maybe our listeners, and my mom as well, she doesn't really know as much about what you're going to be doing?
So plastic surgeons are not just plastic surgeons. When you think about plastic surgery, you think about aesthetic surgery, facelifts, and breast implants and tummy tucks and things like that. But we also are reconstructive surgeons. So somebody has cancer or trauma to one part of their body, we try and gain their quality of life. So maybe somebody's in a really bad car accident and they have like their bones sticking through their leg, or like a tree trunk went through their leg, and like now they have a huge hole in their leg, and the orthopedic surgeons will fix the bones, but now they have like this huge problem where they're missing muscle and they're missing skin and all this stuff that you guys would find disgusting if I showed you pictures of it. But our job is to basically patch them up and make them look normal again and try and not only regain like the form, which is like how they look, but also improve the function and get them functioning back as close to back to normal as we can. We're not perfect, nothing, it'll never be as good as somebody who hadn't had the injury, but we try our best. And then, like you said, Cher, I'm doing an extra year in hand surgery, which is very intricate, trying to help people who have hurt their hands or people who have congenital problems from young age or degenerative problems like arthritis as they get older. And I'm going to do an extra year trying to learn more and specialize in that. But I don't think that's all I want to do because, like I said, I love doing breast reconstruction. I love everything about plastic surgery and helping people as much as I can.
Right.
So
but
cool.
hand surgery is so intricate because there's so many different...
Right, if you can do that, you can do everything.
Anything because it's so intricate. And, people hurt their hands all the time with lawn mowers and everybody's working
Losing
with
a finger,
their hands. And to be able to do that too, wow, because it's so intricate.
Yeah, hands are basically how we interact with the world around us. We think of how much you do that you take for granted just by using your hands, and you don't realize it until you can't do it anymore.
So true.
And I feel like I haven't met a person who hasn't hurt their hands at some point in their life, either as a kid, every time I tell somebody I'm going into hand surgery, they say, "Oh, look at this scar that I had," or like I had to have this surgery, or they say, "Oh, doc, I got this problem. Can you help me?" They start asking me all sorts of questions. So it's definitely a much needed field, and you can do a lot for people. So that's what drew me to it.
Just wonderful.
Yeah, you're so cool. I have such a cool husband.
It's unbelievable.
But we're doing this year in Miami, and I don't know if she even realizes, but so many women in Miami have big butts. Like everything's like the butts. In New York, I didn't notice it that much. I feel it's like so funny I could talk to you about this stuff because you're a plastic surgeon and you get it. Usually I would just tell you this stuff. But it's so interesting how butts are so in style right now. Like, have you noticed that?
I like
big butts and
I cannot lie. It's true that in Miami the look is a little bit different.
It's so interesting.
South Florida has become the butt capital of the world, of the U.S. at least.
Wow.
And it's a big thing. It's a big thing.
It's so funny. In her day, like everyone liked the flat butt. Like she still can't get over having a bigger butt. I'm like, Mom, like show off your butt. It's okay. And she's like, no. She's like, no, like make it look flatter.
Yeah,
I'm like, no.
It's unbelievable how it is now.
Yeah.
So what is like what is it? Butt injections people
Brazilian
are getting?
butt lift?
What is it?
So first of all, before I get started, I just want to say, I want to do a little disclaimer.
Okay.
This is not medical advice that I'm giving. I cannot give you medical advice. If you have any questions about anything that we talk about, I would recommend that you find your own plastic surgeon and speak to them about this. I cannot give you any medical advice to this podcast. So don't take anything I say as medical advice, okay?
Gosh, he's so professional.
Just wanted to say that starting out. Just wanted to say, but what a Brazilian butt lift is, what you say, honey, is actually called, it's gluteal fat grafting. So what that means is you take liposuction equipment and you harvest fat. You take it typically from the abdomen and the flanks, sometimes also from the thighs and the back as well. And
Excuse me, what happens if you don't have fat?
Then you can't have the procedure because
you should gain weight a little before.
It doesn't really work. You can't really gain that much weight in a short period of time. But if almost everyone has some fat, and plastic surgeons are very good at finding the fat when we need to. But I will say that for a Brazilian butt lift, you do need quite a bit of fat, a lot more than we use for, like, say we do fat grafting to the breast. You need a lot more fat than something like that, and a lot more than fat grafting to the face, especially. So you take all this fat from all the different parts of the body, wherever you can get it. Right. You spin it down and separate it from like the fluid and like whatever little blood cells are there. Right. And you basically try and purify the fat. So you're only left with the fat. And then you inject it into the butt to try and help lift and augment or increase the volume of the butt. So it's a double whammy. You decrease the size of the waist and really snatch that waist, which all the young girls like nowadays. Mm-hmm. But you're also increasing the volume of the butt area, the gluteal area, and that kind of changes a woman's shape from being more kind of like straight down to being more of like that hourglass shape that a lot of women are going for. And like you said, Cher, big butts are in, and a lot of women are getting Brazilian butt lifts, they're getting gluteal fat grafting. It's very common. A lot of plastic surgeons and surgeons in Miami are doing it, and that is all they do, some people. Wow. Some people will do 3, 4, 5 of these a day, and that's all they'll do.
But let me ask you something. When you're lifting are you lifting, like, do you actually, like, make incisions underneath, like,
for sagging butts?
Yeah, for sagging, and lift it and then put the fat in it?
So it really depends. So you have to look at somebody and see what's the quality of their skin. Are they just like a little bit deflated and they just need some more volume? Or is it somebody who maybe lost a lot of weight? Maybe they were very large before and they had a really good diet and exercise program, or they had bariatric surgery, like a gastric bypass, something like that, and they got a lot smaller. A patient like that who did have bariatric surgery, had a bypass, will probably have a lot of excess skin that you may need to lift with some sort of skin incision. But otherwise, a normal person who didn't have a massive weight loss type of situation might just need some fat put in, and that'll help increase the volume and therefore decrease the sagging of the skin, because skin sags when you lose volume, right? Because it's like you take air out of the balloon and now the balloon is deflated. So by putting fat in there, you can help increase the size and help in a lot of ways fix the sagging skin just by doing that. So you make tiny little incisions, just enough to get a cannula in, which is like a long, looks almost like a stick, but it's made of metal, and you put the fat into the butt area, and the artistry and what requires a good plastic surgeon is knowing, how to shape someone's butt and where to put the fat and how much to put and how to do it symmetrically and where to plan your incisions and a lot of things like that go into it. That it makes it somewhat, it's one of those things that's not super hard to do. Almost any plastic surgeon can do liposuction, but may sometimes be hard to do well.
Wow, that's so interesting.
But
so you wouldn't get any cellulite from that? Like, 'cause it's like fat you're putting in. So does that create a lot of cellulite in the butt?
So the thing about fat grafting in general is that at least 50% of the fat that you put in goes away.
I was just going to ask you that. So then how can you, knowing that only 50% will actually work on the patient, isn't it hard to actually shape it, because you're shaping it thinking all this fat's going to last, but only 50%, and it might not be even on one side versus the other?
Well, that's part of the planning that goes into it. You have to always try and put more, and therefore plastic surgeons put a lot of fat in somebody's butt because you know that a lot of it's going to go away. And you can't really predict how it's going to change over time. You just hope that as much of it stays as possible.
Wow, it's so interesting.
So interesting.
And what about the difference between that and some people will do actual injections, right? Not fat. They'll use filler.
Yeah, so there is other things that some people can inject into their butt. Some products that have been used are things like Sculptra, or some people will use Radiesse, which is a type of filler, or even some of the hyaluronic acid fillers like Voluma and things like that.
You need a lot of that.
That's an in-office procedure. It doesn't need. It's not technically not surgery, whereas a Brazilian butt lift is surgery. You need a lot. It's very expensive, and probably doesn't get you as much bang for your buck if you really are looking for a big thing. You'll see a lot of non-plastic surgeons offer that to patients because they can't really do the surgery. They're not really able to do surgery and go to an operating room. So it can be done, probably not as effective.
Now, how safe are these procedures?
So, great question. The thing is, here's the thing.
Okay.
And what a lot of people don't realize is that a Brazilian butt lift is actually one of the most dangerous procedures that plastic surgeons do.
Really? Because it's just a tissue thing.
And everyone's doing it, I feel like.
Everyone's doing it. And, for as many people that are getting the surgery, not as many people are talking about the risk. It's actually a very hot topic in Florida right now. And to understand the what's going on, I have to kind of tell you about what the risk is. So as of any other procedure, surgical risk, there's bleeding, there's contour deformities, like, asymmetry, like you just said. But the thing is with Brazilian butt lifts especially is that when you put fat into the butt, if you accidentally put fat into the muscle of the butt, like the gluteus muscles, the gluteus maximus specifically, because it's the most superficial muscle that sits right below the fatty layer and the skin layer, there's a risk that it goes into the veins of the that drain the butt muscles, the gluteal vein, and it can travel, the fat globules can travel from the vein of the butt up to your lungs and block your ability to basically exchange blood with gases and basically give you an embolism, almost like a pulmonary embolism, but it's called a fat embolism. And those are potentially deadly complications. And the death rate as of 2018, a bunch of plastic surgeons got together from the American Society of Plastic Surgeons, and through surveys that were sent out and through looking at the mortality rates were estimated to be about 1 in 3,000 people will die from a Brazilian butt lift due to a fat embolism.
Oh, wow.
So really, in terms of...
And that could happen to anyone, right?
So in terms of outpatient surgical procedures that plastic surgeons do, that's probably one of the riskiest procedures that are done. So that set off a bunch of red flags, right? So in about 2017, a bunch of plastic surgeons that are aesthetic plastic surgeons, but academically focused in what's called the Aesthetic Society for Education and Research Foundation got together and they sent out a bunch of surveys and looked at, okay, why is this happening? Right. And they found that the risk of this happening are increased when you put the cannula to inject the fat below what's called the subcutaneous plane, which is the plane where your fat normally sits, and below that into the muscle. So if you are injecting fat into the muscle, it's much more likely to happen. If you point the cannula down towards the muscle, it's much more likely to happen. And if you are using a smaller cannula, it's much more likely to happen. So their recommendations were to only put the fat in the subcutaneous plane, use bigger cannulas, and never point the cannula down. The Florida Board of Medicine in 2019 took those recommendations and they basically mandated that no plastic surgeons performing Brazilian butt lifts were able to inject fat into the muscle. You have to inject fat only into the subcutaneous plane.
Right.
So that's pretty common sense, right? You know that this can happen by putting it into the muscle, so stay out of the muscle. However, it's not that easy. I've done a lot of liposuction, and although I know where the tip of the cannula is, and you know where you are, it can be very easy to really quickly, accidentally, put the cannula into the slip a little bit. Wow. You can see how it can happen. And even after all those recommendations were made, there has still been about 10 deaths in the South Florida area since 2019 of women undergoing Brazilian butt lifts.
And they're going to reputable doctors and everything.
Oh, I can't. Who knows? But some of the deaths have been by reputable board-certified plastic surgeons.
By anyone, I would think. Yes.
So just recently, this May of the 2022. The Florida Board of Medicine met, and they realized even after these recommendations, these mandates that we put out saying you have to inject fat in the subcutaneous plane, after all of the talk that's been going on and all of the meetings and everyone knows about it, we're still having deaths and it's still happening. So what do we do now? So they put a mandate out just recently. This just happened that now plastic surgeons cannot do more than 3 Brazilian butt lifts in a day, because they think that maybe fatigue, if you're doing more than 3 in a day, you're more fatigued and therefore maybe a little bit less careful.
Oh, wow.
Because fatigue affects us all. It's harder to, if you're on your 7th patient and you're operating if you started operating at 7 a.m. and now you're operating at 7 p.m., maybe you're not as, on the ball and you're not as alert. The second thing that they said is that you have to use ultrasound. So ultrasound
that's a good
while
idea.
you're doing the injection
That is a
to
good
show
idea.
that the cannula is
not.
in the subcutaneous plane above the muscle,
not in the muscle.
outside, and you have to actually document that the ultrasound results and put it in the patient's chart.
Oh, wow.
So it has to be there.
Wow.
That's good for the patient,
That is
though.
good.
I
It's
think
good
that's
for the
really
patient.
good.
Is it hard to do ultrasound while you're doing it? I guess you have an ultrasound tech.
No, you do it yourself because you have to have like a sterilized probe sheath that you put over the probe so that your probe is sterilized. You can use in the operating room. It's not hard. It definitely takes more time. It's gonna slow down your procedure. You know, you're doing a lot of passes to put all this fat in, and you're doing, you're trying to sculpt a whole butt. So it's going to take you more time, and it's going to be more tedious. And some practitioners will say, "Hey, I've been doing this for X amount of years. I haven't had this complication. I know where the cannula is. I know how to stay safe. Why do I have to do this?" So there's some frustration from a lot of people in the community that are saying, this is going to hurt my bottom line, my business model. Why should I be punished for so-and-so bad technique or whatever reason?
But it only takes one time to have some accident happen or something to go wrong. So it's just a good safety feature, I think, for patients.
It's about that time in our podcast where we're going to hit pause because we have something really exciting that we want to share with you.
We wrote a book together.
That's right. It's called A Bond That Lasts Forever. And basically, it's how we got this close and how you can too. It goes over all of our life's ups and downs, our struggles and obstacles, and became as close as we are today.
We share tips and quotes and actionable steps on how you can create your own ideal relationship. We even share photos on us throughout the years so you can see us on a whole different new level.
It's so true. Anyways, we loved writing this book, but we hope that you love reading it just as much, or maybe even a little bit more. Anyways, you can pick up the book at abondthatlastforever.com. You can get it at Walmart, on Amazon, at Barnes & Noble's,
or wherever you get your books.
Hey, you're stealing my line. Anyways, we hope you love reading it. Now, let's get back to the podcast.
I think so. I have to say that for all I've researched about this, I haven't done too many of these. I'm not an expert in Brazilian butt lifts. So I can't say that I would feel so comfortable doing it without ultrasound. I think ultrasound's great.
I think so too. Why not?
I think an extra safety measure isn't the worst thing. If I was a patient, I might want to talk to my plastic surgeon and say, how do you plan on doing this? Even outside of Florida, where the mandate is not to use ultrasound, and it's left up to the practitioner. If you're interested in getting a Brazilian butt lift, I would definitely talk to my plastic surgeon. Make sure I have a board certified plastic surgeon that's used to doing this, and talk to them and see what they say about this, because it is definitely a risk. And you're going in for cosmetic surgery. You don't want to not be able to go home after your surgery.
Right.
Oh my gosh.
That's something.
I feel like you're going to blow so many listeners' minds with this, because so many people think it's just cosmetic surgery. You're just making my butt bigger, no big deal.
Right.
But there's a huge risk there.
Well, any surgery has risks.
Yeah, that's true. But still.
We hate to say it, but any surgery has the risk of death involved. If you are going in for even the smallest surgery, the complications can happen, and you never know. But 1 in 3,000, it's probably at this time less than that. I think it's probably more safe than 1 in 3,000 because we've been talking about it so much, and there's been so much discussion about this risk. But it's still a pretty high risk of a fatal complication in what should be a routine procedure.
Wow. With filler, can any of that happen, or it's less likely?
So
Good question.
probably possible even still if you're to put the filler in. Filler is smaller than fat typically. The droplets of the filler that you put in is smaller, but a lot of the problem is that some people are getting not medical grade filler. They're not getting what is.
I've heard about that. I heard a woman lost her legs because they put in cement or something in her butt.
It's very sad.
It's very sad.
Oh, I've heard that too, or
terrible.
terrible. And you can never get that removed, or it's so hard to get that removed once they put in that horrible fake tire, whatever.
Who knows what it is? Sometimes it's just silicone liquid, free silicone. Sometimes it's medical grade silicone.
terrible, yes.
Sometimes it's cement. You
It's
don't even know what it
terrible.
is.
Yeah.
These are performed by not plastic surgeons,
Right.
people who have no right doing this to people, and they're taking advantage of people. We see this a lot in the transgender population who get taken advantage of, and it's very sad because once you have this stuff put in, it goes everywhere. It tracks along the tissue planes, and it spreads, and it almost is impossible to get out.
Right.
And the patients are so unhappy, and it's a shame.
Right. No, you brought up something also how they are only allowing to do 3 a day because they don't want the doctor to be fatigued or tired. I've heard also that with plastic surgery, a lot of patients are looking into doctors that don't do so many procedures in a day, like one right after the other, because then mishaps happen, and they're not, because they're doing so many in a day that they get exhausted, and that's where mistakes happen. So they look for like plastic surgeons that don't do so many procedures in one day.
Look, we're human just like everyone else, and the more work you do, the more energy you put into your day, the harder it is to keep that prime level of focus. And you don't know what's going on with a person each individual day, especially with sometimes doctors are on call the night before. Sometimes we have our own family issues, so I can't say morning surgery versus afternoon surgery and what's the best route to go, but maybe there is something to be said about doing less surgery in a day.
How do you find the right surgeon for you? Like, do you have any recommendations?
It's a great question. So if you're looking to have plastic surgery, you should always go to a board-certified plastic surgeon through the American Society of Plastic Surgery. They'll be able to display that and proudly will tell you that they're a board-certified plastic surgeon. And there is a real difference because the certification process takes a lot of work, and it's a very difficult. And so definitely a board certified plastic surgeon. I would recommend probably going to someone who does that procedure frequently, someone who does it maybe once a week or twice a week even, and it's not somebody who's only done it like once in the past 6 months to get that best result, and somebody who's probably been doing it for a while, so a couple years into training. And then you also want to make sure that person has a good relationship with you. You like the person that's going to be operating on you, and you trust them, because it is a process, and there has to be a lot of trust that you put into your surgeon who is going to be taking you through this process of changing your body to how you and them feel like it should look afterwards.
I do believe you have to have that connection with the physician, and really believe in the physician understanding what you want versus what they can give to you, and have that relationship, because you are going under the knife, so you have to feel comfortable with the surgeon that's going to do it.
Yeah. Totally agree. Well, I want to play a little game with you, a little fact or fiction, and you can tell us what's true and what's not, because we are constantly hearing all of these things on the internet about, like, especially like on Instagram and TikTok, about things that are like real, and I don't know if I always believe them, and I feel like I have you on today, and you'll be able to give all of our listeners and us the real truth. Does that sound okay with you?
All right, I'll do my best. Let's see how it goes.
To the test. Okay, all right. Fact or fiction? Wearing a bra to bed prevents sagging boobs.
Fiction. Breasts sag over time due to gravity, due to volume loss, for whatever reason that might be, hormones changes, menopause. Sorry, Dawn. And weight loss, weight gain. Sometimes,
but not wearing a bra. That's so interesting.
I always thought that wearing a bra helps it, keeps it a little bit longer from the gravity.
Sorry, ladies, gravity always wins. Doesn't matter what bra you wear. But I will say that if you do have very large breasts, I'm talking like 40, double D, triple D, F, those large breasts, wearing a bra at night that's well-fitting might be more comfortable for you. It can help support you more. I don't think it's going to prevent sagging, but it definitely might give you some comfort and help you feel better while you sleep.
Wow.
So interesting. Okay.
I have one. Can I do one?
Yeah.
So, does filler stretch the skin?
Yes and no. So if you put a small amount of filler, if you're very conservative with filler, your skin naturally has elastic properties, so that once the filler goes away, it can snap back into place. But if you're getting a lot of filler put in and you're getting it done frequently, you're going to stretch the skin so much that it just is unable to get back. You're going to expand the skin. And once it's expanded and undergoes those changes, then it's unable to snap back after so much expansion.
Because I notice a lot of young girls say a very big thing is lip fillers. I mean, everyone's getting their lips done. So they should be careful, because when it dissolves, their lips will look all like with wrinkles around them.
Well, the truth is that if you're putting a lot of filler in your lips and you really want that augmented look, you might need to continue putting filler in to keep up with that look that you want. Because once the filler goes away, and maybe it won't all completely dissolve, but a majority of it will dissolve over 3 to 6 months, however long the manufacturer says, depending on what you're getting. Your skin is now expanded, and it's going to start sagging. It's going to start falling, and you're going to have an elongated lip, and it's just unfortunate.
Oh, wow.
Wow. So I also heard a big thing today is people are doing lip lifts.
Yes, lip lifts are common.
Right.
As you age, the length between your nose, the tip of your nose, and the middle point of your lip, which is your Cupid's bow, does tend to increase over time. And there is a difference between a youthful 30-year-old lip and a 60-year-old lip. And so one procedure that is done is a lip lift, where you basically are cutting some of the skin out. That procedure can look very good, but it also has to be done perfectly, because the scar can be very visible if not done perfectly, or even if it is done perfectly, because if the scar can be prominent, and then you have this big prominent scar on the center of your face.
And also, like, if you take too much, you can't close your lips very well, right?
Well, once again, it'll stretch, and gravity does always win over time.
So
but yes, if you in the immediate period, if you take too much, you might be too tight.
Interesting. Okay, next one. Botox can be used as a preventative.
That's true. What Botox does is it basically temporarily paralyzes or weakens the muscles that cause the wrinkles in our face, especially those what we call dynamic wrinkles, which are caused by the muscles. Some wrinkles are dynamic, which means they're caused by muscles, and some wrinkles are static, which means that they're nothing will change them. It's just over time. But those that are caused by muscle movement, if you get the muscles weakened and temporarily paralyzed, and especially if you're doing it frequently, it will prevent the formation, or at least the worsening, the deepening of those wrinkles, and lead to less of a deep wrinkle over time. I've definitely seen patients that on spots where they ask me to do their Botox, the wrinkles don't come back as strong. And then I'll see them maybe a couple years later, and the wrinkles that the spots that I never did have much worse wrinkles than they did before. And then I'll do 1 or 2 treatments on them, and then they'll come back and the wrinkles won't be as bad. So if it's the muscles that are causing the wrinkles, then yes, Botox can be preventative.
There's a few different Botox formulas. There's
like Dysport, Zoom in.
Right. Is there one better than the other, or they all do the job?
All pretty similar. Different practitioners have different preferences. A lot of it really depends on the representative, your workings with the company, and provider preference, but they're all pretty similar. I will say that if you have an egg allergy, you can't have Dysport. So some people that do have an egg allergy can't have Dysport because of the way it's made. But other than that, they're all pretty similar.
And one other question about that. Can you get immune to it? I mean, using it for so many years where your body just doesn't take to it anymore? Can that work if you start? I mean, I know a lot of young girls nowadays are using the Botox, like you said, for preventative. But if you start so young, by the time you're 50 or 60, will it still work for you?
So the basic research does show that if you're getting these treatments done more frequently than every 3 months. So you say you got it done a month ago and you want to go get it again, and you're getting the same thing done. You're getting the same Botox syringe placed in the same spots, then your body is more likely to make antibodies, and therefore the antibodies that your body makes will more quickly neutralize the Botox toxin, which was what causes the temporary paralysis, and that will lead to less of an effect. So that's why the recommendation is that you do not get these done in intervals less frequently than every 3 months. So 3 months at a minimum before getting another one done. If you get Botox and then maybe you do it too often and then maybe you become immune to Botox, you may be able to do Dysport or Xeomin because they're slightly different, but it might always be somewhat less effective. I'm not exactly sure.
Interesting.
So interesting.
Yes.
That is interesting. Okay, running causes your face to sag.
Yes, but not for the reasons you think. Why do you think that running causes your face to sag?
Because of like the pressure.
The pounding.
When I'm running, I'm like, ugh, my face is like, moving up and down.
Like the
gravity.
gravity.
You're like,
Yeah, that's what I thought you would say, but it's not. It's probably not because of that. It's more likely because when you're running, you're getting a lot of sun exposure. And sun exposure leads to skin damage, and skin damage leads to worsened skin and more likely skin sagging, especially on the exposed areas like your face. Also, runners who run frequently tend to have some weight loss and tend to be thinner. And just like with your breasts, if you have a loss of volume, and volume loss leads to deflation, which will lead to sagging. So people who are running.
So twist. It's a definite twist right there.
So always wear your sunscreen.
Yes, definitely. Okay, next one. Fact or fiction? Waist trainers make your waist actually skinnier.
Fiction. Total fiction. So they may look skinnier while you're wearing the waist trainer. You may look thinner while you're wearing your Spanx or your faja, which a lot of the women like, the fajitas, as they say. But when you take them off, you're going to go back to normal. It's not
so interesting.
Your body won't permanently be thin.
Right. Sometimes they show it like you wear this every day for a long time, and then it's supposed to like change your waist.
That's fiction. So I will say that in somebody who had surgery, like a tummy tuck or liposuction to the abdomen, wearing the compression garments will cause lymphatic massage type picture, and will push edematous fluid out of that area and may improve swelling. But that's after surgery to remove the fat. Just putting a waist trainer on, something that causes compression, won't kill the fat cells in itself. Your body is just going to go back to its normal state once you remove the waist trainer.
So that's probably the same thing you would say about, have you heard of like nose, to make the nose thin, these nose clippers.
She had that.
Oh, yes.
To make it thinner, and you put it on to mold the nose.
All right, Judy Garland. Judy Garland over here is going over the rainbow. But no, the nose clips don't work. They don't work. For the same reason. Your body will always go back to its normal state, no matter what crazy stuff we do to it.
I'm actually happy to hear that because I tried a waist trainer and it really hurts your back after a while. It is not comfortable at all.
Why would you try?
Well, everyone was doing it, so I tried it. It's not comfortable. I didn't buy one, but
women go through a lot. There's a lot of pressure on you guys. It's tough out there.
It is really tough out there. I'm glad that you understand. Okay, can ear prominence be fixed non-surgically? You see sometimes people with like more like the Mickey Mouse ears, they say, that go out.
Yes, but only if it's done at a very early age. And when I mean early age, I mean within the first 2 weeks of life.
Wow.
So when you're born, for the first week or so, you have a lot of estrogen in your body from the mother. And that estrogen allows your cartilage, which is what makes up the floppiness of your ears and your nose as well, to be more malleable. So you're able to form it and change the shape into how you desire. But after about 2 weeks, maybe 3 weeks tops, the estrogen leaves your body and the effect is no longer. Your cartilage may be malleable, you may be able to deform it, but just like everyone else, it goes right back into place. So non-surgically, I would say no after about 2 to 3 weeks.
So you really need to catch that very early if you feel that your baby's ears are a little bit more prominent, to tape it or do something like that.
If you see that you feel that your baby has very prominent ears, I would consult with your pediatrician about possibly referring to a plastic surgeon to talk to about what your options are, because not every deformed ear or misshapen ear can be fixed non-surgically, but some can.
Oh, wow.
So interesting.
So
Wow.
interesting. Yes.
So you got to be very aware those first weeks of life.
Yes, very aware.
So interesting. Okay, last but not least, you can have surgery without it leaving a scar afterwards.
Totally false. I can't tell you how many patients come in and they say, I want this done, but I don't want any scar. How are you going to give me no scar?
That would be my mom over here.
Exactly.
Literally.
And I tell them that's impossible. Any surgery you do is going to leave a scar. Even if you have like a little bump or a lipoma or a mole, I always tell patients, look, you're trading a bump for a scar. You're going to have a scar here. It's my job to try and give you the best looking scar possible, but you're going to have a scar. There's no way. What plastic surgeons do is they try and give you a thin, fine scar, and they try to hide it in your normal shadows and your normal creases of your skin to try and make it less noticeable. But giving you no scar, no way.
And I also heard it's the post-op treatment. It's how well you as a patient takes care of that scar. Like you're putting it on the ointment that the plastic surgeon recommends and really being diligent about it, that how the scar will heal.
Yeah, so a lot of people will come and they'll say, hey, what should I put on my scar? And for the first couple of weeks, I typically say something like bacitracin or triple antibiotic ointment, as long as you're not allergic to anything that's inside the ointment. And then after a couple of weeks, when the skin has totally healed, then the data has really shown that the only thing that can help prevent the formation of hypertrophic and keloid scars, which is what most patients are deadly worried about, is silicone-based gel or silicone taping. For a mechanism that's not completely understood, there's some theories of why that works, but the data shows that can help in the early phases. I'm talking like from 1 month to maybe 6 to 10 months when the scar is maturing, that can help prevent a hypertrophic or keloid scar, especially in patients who are more prone to that. A scar matures up until a year, so the scar always is going to look the worst as it does immediately after surgery, and it's only going to get better. So, you can't really judge your surgeon on how your scar looks until 1 year after surgery.
And don't you agree, always never have any sun exposure to a scar after surgery?
Totally. Sunscreen is key for your skin in general, but especially operated areas, because nothing's going to make that scar look more red and angry than a full day of the sun. So sunscreen is always a must. That's why I like using the silicone tape, because it covers the scar as well as giving you that silicone effect.
That's interesting. Yeah,
that is really
very
interesting. Can you still use that after a year, or by that time it's
you can? I tell patients use it until you get sick of using it, but you can. But I think that after a year or the scar has fully matured.
Is the silicone tape over the counter, or is it a prescription?
No, over the counter. You can buy lots of different places.
So interesting.
Interesting.
Wait, okay. I have one more major question I need your honest opinion for.
Okay.
What plastic surgery do we need?
Oh gosh, you saved the hardest question for last. Okay, all right. Let me just take a quick look at you guys. All right, I think you guys are in definite need of cuteness reduction surgery. Because you're just too cute. You're just both too cute.
This is why I keep him around, ladies and gentlemen. No, Jared, this was such a great podcast. Like, so informative, so interesting. I love seeing you.
I love this topic.
I know. I can literally talk for so long about this. And it's so cool because you're my husband, but like, you're also such a cute plastic surgeon. You're like so good.
Well, such a brilliant
He's so smart. It's very sexy.
Yes.
You're very intelligent.
Well, we'll talk more about that later.
All right, anyways, thank you so much for coming on this podcast.
Wonderful.
Thank you,
Thank you.
Chattermouths. We'll see you all next time. Bye.
Wait, before you go, if you enjoyed this episode, please leave us a review. It means the world to us.
Yes, we read every single review and we love hearing your thoughts. And if you think that one of your friends will enjoy this episode too, then please share it with them or share it on social media and tag us, and we promise to reshare. Anyways, thanks for listening and we'll see you next time. Bye!